Okay, we can begin now.
Hello, everyone. I'm Marian Enotabi, and welcome to the WHO Africa Media Briefing. First, some housekeeping. You can choose to listen to this press conference either in French or English by turning to the globe icon on the bottom right of the screen and selecting your preferred language. Bienvenue à tous, vous pouvez choisir d'écouter la conférence de presse en vous rendant sur l'icône du globe à droite en bas de l'écran en sélectionnant votre langue préférée. We are really sorry Dr. Lindiwe Makubalo, who was supposed to lead this press conference, is unavailable, but we do have Dr. Humphrey Karamaji, Senior Technical Officer at the WHO Regional Office for Africa. I will now hand over to Dr. Humphrey Karamaji to introduce our other panelists. Over to you, Dr. Karamaji.
Thank you. Good morning, good afternoon, bonjour, and welcome to all the journalists joining this press conference on this World AIDS Day. For this discussion today, I'm pleased to be joined by Dr. Benjamin Sofa, who is the Principal Research Officer with the Kenya Medical Research Institute and member of many technical advisory committees at the National Ministry of Health in Kenya. You're welcome, Dr. Sofa. We also have a number of our colleagues, Dr. Fiona Braka, Dr. Frank Lule, and Dr. Serge Bataliak, who will be joining the call to assist with any issues which we may need to discuss. Thank you. I can go into the overall remarks that we have for today. At our discussion today, I will also be launching the latest version of the Africa Health Statistics, which is our publication that consolidates the latest information on the health services and health investments across the countries of the Africa region. However, I want to start with recognizing the World AIDS Day today. This year, we recognize this day under the theme, Equalize. We are celebrating this day under a cloud that threatens the progress we have made so far. HIV remains a major public health issue affecting millions of people in our region. Over the past decade, the region has achieved some remarkable successes with new HIV infections having declined by more than 44% and AIDS-related deaths reduced by over 55% in 2021 as compared to 2020. However, this progress has stalled and investments have been dwindling in our region, which has really enhanced the existential threat that this pandemic poses to our health and well-being. Progress towards ending HIV/AIDS by 2030 is off track and in danger of stalling. Within our region, in the Africa region, HIV prevention programs are currently reaching only 40% of adolescent girls and young women. 1 in 3 key populations, who are particularly vulnerable to HIV, have regular access to HIV prevention services. To reach the target of ending AIDS by 2030, which is our SDG target, it is important that countries are able to reignite the efforts to increase and sustain access to essential HIV prevention and treatment services. We must ensure that everyone, everywhere has equal access to HIV prevention, testing, treatment, and care. We are therefore calling on everybody to boldly recognize and address the inequalities which are holding back progress towards ending HIV/AIDS and to equalize access to essential HIV services, particularly for children and key populations and their partners. Now, turning to the report on the Atlas of Africa Health Statistics that we are launching today, this is a major contribution that we as WHO are making towards availing health information on the Africa region. The Atlas provides a comprehensive overview of the health situation in the Africa region and is a means to monitor progress towards regional and global priorities in health. One of the major observations that the report makes is that it shows how far off track we are to meeting the health objectives of the 2030 Sustainable Development Goal. A drastic slowdown in the progress against maternal and infant mortality, for example, is projected to leave the region with maternal deaths that are 5 times higher than our 2030 goal. Infant mortality is projected to be more than double the 2030 milestone that we had set. To be able to reach the 2030 maternal mortality target, we need in the region to lower the death rate by over 86% from the current estimates, which is a feat that is quite difficult on its own at the current pace that we are making. It is, however, important to note that the slowing momentum comes after 2 decades of remarkable progress by the region in a lot of health indicators, which saw significant declines in mortality and morbidity associated with many conditions, including maternal, newborn, and child health, as well as improvements in reproductive health within our region. Inadequate investments in health and funding for health programs are some of the major drawbacks to meeting our health targets. And if nothing is done to accelerate investments in the health sector, the region will surely not be able to reach its aspirations. To be able to accelerate the achievement of maternal mortality target of having fewer than 70 deaths per 100,000 live births, particular attention should be paid to the provision of antenatal services, which are critical to the future of both the mother and child's health. However, despite the available evidence of the key role antenatal care plays in reducing maternal and neonatal mortality, millions of women in our region still do not have access to it. There remains a high variability from 30 to 90% of our mothers being able to access antenatal services depending on the different countries. Additionally, an average of less than 1 in 2 pregnant mothers in Africa give birth in the presence of a skilled health personnel, with only 12% of mothers and their newborns that need emergency care actually receiving this. Many or more efforts are also needed to accelerate the decline in neonatal mortality. We've been seeing a fairly good decline in neonatal mortality, but not at the pace that it needs to happen. The pace seems to have slowed down. It has only declined, the neonatal mortality has only declined by 4% in the decade 2010 to 2020. And this slowdown in the decline in neonatal mortality and also in many other of the mortalities has been further exacerbated by the disruptive effect of the COVID-19 pandemic on service provision. Crucial health services such as postnatal care for women and care for the newborns, neonatal intensive care services, antenatal services, immunization services were all disrupted during the pandemic, and many have not yet recovered, in part due to the changed perceptions of health and safety by providers and users of services. Since 2021, the Africa region has also faced a resurgence in vaccine-preventable disease outbreaks. Measles cases rose by over 400% between January and March 2022 compared to the same period the year before. Countries have made efforts to gradually restore the key health services impacted by the pandemic. However, significantly more efforts and interventions are required to set the region back on track towards achieving health priorities by the end of the decade. This atlas provides a rich source for these and other interesting health statistics, information, and trends in the Africa region. We invite you to explore the information that is presented in the atlas at great length, and we also encourage you to get in touch with us and with the countries if there are issues that you would want clarification on relating to the status of health within the Africa region. Before I end this briefing, I also want to recognize the effort being made by the government and people of Uganda in containing the ongoing Ebola outbreak. The response efforts that have so far been intensified over the past 2 months are paying off. Of the 9 Ebola-affected districts, 4 have reported no cases in more than 3 weeks, and we are seeing a general decline in cases in all the districts in Uganda. As WHO, we continue to reinforce our support to Uganda in all aspects of the outbreak, to halt the virus and bring this epidemic to an end as soon as possible. Thank you so much for joining us today, and a very warm welcome to my fellow panelist, Dr. Sofa, to also give his remarks, and we look forward to interesting discussions today. Thank you very much.
Thank you very much. Thank you very much, Dr. Humphrey Karamagi, for that update. Dr. Benjamin Sofa, can you please tell us what are the challenges that Africa is facing in achieving the Sustainable Development Goals? It would appear things got better between 2000 and 2010, but that trend stopped right before the COVID-19 pandemic. Please tell us what happened and what can be done to ensure that these goals are met. Over to you, Dr. Sofa.
Thank you, moderator. Thank you, my brother, Dr. Humphrey Karamagi. And good morning, everyone. Good afternoon, depending on which part of the continent you are. And most welcome to our colleagues, the journalists. It's very rare that we get to opportunities to discuss a bit of technical health issues with very important members of our society, like journalists, who help us to pass in key and important messages to the general public. I want to take this early opportunity first to thank my colleagues in WHO Afro, for inviting me and honoring me this opportunity to join in this launching of this very important atlas of health, African health statistics. I think to come very quickly, directly to respond to the questions you asked, moderator. I think as has been highlighted by my brother, Dr. Humphrey Karamagi, we've seen from the report has noted that Africa has witnessed an initial improvement, or rather we were generally on track in the improvement of across all the key priority areas, but then there was a significant decline that has happened, especially in the past few years, and especially in the area of maternal, child, and infant mortality, where there's been significant decline in the improvement, causing a bit of worry whether we will actually meet the SDG targets by the year 2030. I mean, this is also not very unique. I think the report has highlighted slow progress in a couple of other areas. Key among those are those related to SDG number 2, that focuses on reducing hunger. And this is very important because the report highlights that between 2015 and 2013, we've actually seen a worsening of the hunger and food insecurity situation from about approximately 52% to 59%. I mean, the report highlights that there are a couple of issues that could be attributed to this observation. This could be explained by challenges that have affected the region, including disease outbreaks like the COVID pandemic and other outbreaks like Ebola in some parts of the region. Of course, the ongoing climate change and particularly extreme drought in some parts of the region, some pockets of conflict within the region, growing inequalities. All this collectively, directly and indirectly, affects economies of many countries in the region, and hence posing a challenge towards attaining some of these critical targets, particularly in this area of food security and reduction or eliminating hunger by 2030. On other areas also highlighted in the report that have shown some sort of significant slow progress include basic areas for access to basic water and sanitation services. The report has pointed out specifically, I think worth noting, is that the population accessing basic drinking water in the region is only at about 32%, from very far away from the initial target, or the target of 80% by the year 2030. With this kind of progress, it's quite unlikely that actually as a region, we will be able to meet the desired 2030 target. Similar situation has been reported or highlighted within the report around sanitation, with a reported coverage of access and utilization of basic sanitation services only reaching or attaining a 23% coverage within the region. I mean, targets or this lagging behind of trends within water and sanitation, of course, pose a significant challenge within the context of our region, because they pose a major risk factors for exacerbating diseases of poverty, which are already quite endemic within a region. I mean, all is not lost, though. I think there are a couple of areas where there are significant progress that have been recorded, a few pockets in some of the countries. In my own country, Kenya, for example, I mean, similar challenges have been noted in some of the targets, particularly maternal and child health, but there's been at least recorded progress within in areas of targeting or reducing new HIV infection and controlling the HIV pandemic and TB pandemic. So finally, I think as I conclude my remarks, I want first to take this opportunity to congratulate my colleagues in Afro and all the technical teams that went put together this report. I think the report presents a very important accountability and point of reflection tool for all stakeholders in health, for us to start reflecting, especially as we adjust to deal with the ongoing challenges within the region, including disease outbreaks, climate change, and pockets of conflict, and thinking about how we can re-strategize and remodel our health systems to make them more resilient to continue being able to provide essential health services within the context of these challenges. Thank you very much, and over back to you, moderator.
Thank you so much, Dr. Benjamin Sofa, for that remarks. Now that we've listened to all our speakers, it is now time to ask your questions. For journalists who have joined us online, please use the question and answer function on the Zoom application. Remember, you will need to provide a name and the media organization you represent for your questions to be asked. We want to announce that we have additional experts online. They are Dr. Fiona Bracker, Emergency Operations Manager at the regional office here in Brazzaville, and Dr. Serge Bataliak, Strategic Health Information Officer. We equally have Dr. Frank Lule, Medical Officer, HIV and AIDS Treatment and Care. I will start with a question for you, Dr. Lule from The Guardian, and he's asking, if today is the World AIDS Day, how close are we to eliminating HIV and AIDS? Dr. Lule, over to you, please.
Thank you very much for that question. How close are we? As we commemorate World AIDS Day, really, we must confess that we are off track and in danger of actually losing the gains we have made over the years. Our target was to really be at 90% coverage and 90% of those on treatment to be virally suppressed. We were supposed to have reduced new HIV infections to less than 500,000. We have not reached those milestones. So how close are we? We still have a long way to go, especially in the area of prevention, reducing new HIV infections. In the African region, we reported an estimate of almost 900,000 new HIV infections, and that is really high. And when we look at the trends, we have not really been doing so well over the last 10 or so years. The other area, which is in rhyming with the theme of the World AIDS Day, we have several geographies, for example, some countries that are being left behind. And we also have particular populations that are not accessing services. Dr. Karamaji mentioned a few, for example, adolescent girls and young women who are not really accessing all the HIV prevention and treatment services, and also key populations. When you look at the age disaggregation, as a region, we have 78% of the 25.6 million people living with HIV now on treatment. 78% coverage is the total, but when you disaggregate it by age, it's just over 50% of children who are accessing treatment. So we've left the children behind. And there is a lot that we need to do to address the drivers of new HIV infections. We have to expand our programs, and we also have to make sure that we equalize to make sure that everyone has access to HIV prevention and treatment services. Thank you.
Thank you very much, Dr. Lule. It is my understanding that Paul from the Lancet wants to ask a live question. Paul, you can ask your question.
Yes, thank you very much for taking my question. So my question has to do with the recent announcement of the official change of the name designation for monkeypox to mpox. And the question goes thus, the first part of the question is, why did it take this long for something that has been in discussion? People have been talking about it in the ecosystem to be implemented, considering and the impact that this change is expected to have. Hasn't this damage already been done already? And what is being done to ensure that the process is shortened for future development, and we don't have to wait for several months for something that could have made a lot of difference much earlier? Thank you very much.
Paul, we'll call on Dr. Fiona Bracker to answer the question from Paul. Dr. Fiona?
Thank you very much for that question, Paul. Indeed, a few days ago, WHO did announce that the name monkeypox that we have been using will now be mpox moving forward. And really, it's true that discussion did start a while back about the need to reconsider the name monkeypox. By protocol, usually we try to avoid names that would cause any discrimination or discomfort to any, either a person or animal. And so these names are actually reviewed in line with that guidance. The responsibility for reviewing names for these diseases lies with an independent group that looks at the classification of diseases. And it's important that they are allowed to take into consideration several factors before they come up with a name. This was the same as was done for COVID. So we do allow them to take all the information into account and then come up with this, but it was a priority right from the beginning, and we are pleased that it has finally been done. Thank you.
Thank you. Thank you very much, Dr. Fiona Bracker. We have a question for you, Dr. Humphrey, from Radio Namluwe in South Sudan. He's asking, how do we reduce child mortality in African countries? Dr. Karamaji.
Okay, thanks a lot. And I think that is one of really our challenging issues that we have been grappling with for a long time. Child mortality but is primarily driven by neonatal mortality in most countries. And we've been encouraging countries to invest a lot more in trying to address particularly the causes of neonatal mortality. So when you look at the child, that is the person past the neonatal period, there's been a lot of investment in immunization, in child health services, and so on, which has helped to reduce that burden. But at present, a lot of effort needs to be placed on the neonate, because this is what's really driving the patterns that we are seeing in countries in terms of the higher mortality. And we've seen in countries where they've invested in neonatal services, neonatal units, making sure all mothers are delivering in a health institution that has skilled providers. We've seen once that happens, the neonatal mortality tends to go down. So I think really investing a lot in neonatal health, in interventions right from the pregnancy through the delivery, and the neonatal period that will reduce on that mortality would have a significant impact on the child health within the region. Plus, of course, the wider contextual factors which are impacting on the health of the child. Thank you.
Thank you, Dr. Humphrey. Dr. Sofa, can you complement or comment on this? What do we need to do generally? What needs to be done generally to achieve these sustainable development goals? Dr. Sofa.
Good. Thanks, moderator. I think I would agree with the sentiments by Dr. Karamaji. Really, I think there's been lots of investment over the past decade in focusing on child. So the over 28-year-old child below 5, immunization coverages are improving very heavily. At least significant investment also in school health programs or early school health programs, including nutrition programs, which have significantly reduced the mortality in the child below 5. But there's still significant challenges at service delivery points for ensuring safe deliveries and the management of the child below age 28. And I think the focus now, we need to shift the focus to invest and retune our systems to focus on healthy pregnancies, so focusing on the child just before they are born, healthy pregnancies, safe deliveries, and safe care of the neonate. And I think once we do that, then we'll be able to drive down the remaining burden of neonatal or child and under 5 mortality within the region. Thank you.
Thank you, Dr. Sofa. We have another live question from Lionel Lidugu in Nairobi. Please ask your question.
Thank you very much. My name is Leon Lidigu from the Daily Nation in Nairobi, and I have 3 questions. The first one has to do with the ARVs. As we are commemorating the World AIDS Day. Now, this week I spent a lot of time with children in the slums, and we are calling them at Nation, we are calling them the ARV generation, because mostly these are children who are born at the onset when ARVs were being introduced, and now they have come of age. They are 18 plus. Now, these children, especially in the slums, they do not have food, and so they are going on drug holidays and not even taking their medication. And according to the National Endemic Diseases Control Council of Kenya, I asked them and they told me, in fact, there's little they can do because there's lack of funding caused by COVID-19. It has really affected them. So I'm just wondering, what is the WHO doing to address this? And then secondly, we have refugees in Kenya coming from Somalia to northern Kenya. And remember, northern Kenya is already strained with no food. And I was down there and babies are dying and mothers have nothing to breastfeed and diseases are on the rise. And MSF told me they're actually struggling. Considering the fact that Kenya is no longer receiving RUTFs as it used to, and people actually dying of hunger down there. What is the WHO doing about this? And thirdly, there are reports that there's a new strain of syphilis in Nairobi. Those reports have been there from last year. And we also, as a country, facing a nationwide condom shortage. And this will affect our neighbors in our border in Busia, going into Uganda. So I just want to know, has the WHO also reached out to the Kenyan government? Thank you.
We'll direct your first question to Dr. Fiona, then the question on maternal on strategic health, we will direct it to Dr. Serge Bataliak and can be complemented by Frank Lule. Dr. Fiona, over to you, please.
Thank you, moderator. I believe the first question is towards Dr. Lule, please.
Yes, please, Dr. Fiona. Go ahead.
Yeah, Dr. Fiona was saying the first question is directed towards us. Thank you, Lionel, for bringing this issue up about the situation in the slums in Nairobi. And what you have described is really what we need to consider when we are responding to the HIV response pandemic. We are not going to treat ourselves out of the HIV epidemic. Yes, ARVs have really been a game changer. They have reduced death. It's no longer a death sentence. People can live normal lives. But when people decide to go on drug holidays because of another issue, in this case, you've said lack of food, then even the effective intervention is going to actually lose meaning. And that's why in the response, we really work so much, emphasize on the principle of a multi-sectoral response. There are so many determinants, there are so many drivers, and it is not just the virus, it is the environment in which we live. If children are not going to school, if children are not receiving enough food, if the environment is not stable, there is conflict, we are not going to win the war. So the specific example you brought in the Kenyan slums, I think it doesn't only have to be the health sector, it is all sectors to really come together to really address this issue of food shortage, because it's not going to actually come from the health sector. We have other sectors within government that can address this. You also raised the issue of commodity insecurity. In this case, you've mentioned, I think, condoms not being available. I don't remember what the other was, but yes, as WHO, we've been made aware, and this has really been brought to the National Technical Working Group, and not only for condoms, but also to look at the stock status of other commodities, such as testing kits and also medicines for opportunistic infections, such as sexually transmitted infections and TB medicines. So the country is working on this, and they have, I think, costed and tabled this issue to the government, and I think we are following up. But just to let you know that as WHO, we are aware and working with the government and also the national stakeholders within the technical working group to address this. Thank you.
Thank you, Dr. Lule. Dr. Fiona, do you want to comment on this, please?
Thank you, moderator. I believe he has covered it. Back to you.
All right. So we'll move over to the next question. This is directed to Dr. Humphrey Karamaji. The person is asking the main cause of maternal and child mortality in Africa. Dr. Humphrey Karamaji.
Okay, I'll pass that over to Saj. I think he can walk us through that. Over to you, Saj.
Okay.
Thank you, moderator and Humphrey. So the report shows that the main causes of maternal mortality in the region are severe bleeding. So mostly bleeding after childbirth. We also have infection, usually also after childbirth. There's also high blood pressure. So there are many women suffering from high blood pressure. So that we call preeclampsia or eclampsia, and that can really cause a lot of death too. So there's also complication from delivery. So sometimes they don't have all the needed services around. So when there are complications, it's very difficult to take good care of the women, and that can lead to a death also. And also, unfortunately, in the list, we also have unsafe abortion. So unsafe abortion can also lead to a lot of deaths. So Over, moderator. Thank you.
Thank you, Dr. Serge. We have a question for Dr. Fiona from ANSIA, Juba Monitor in South Sudan. She's asking, what is the plan of action for next year, and how far have you gone with the coronavirus pandemic in Africa? What are the major challenges affecting Africa, and what can be done? Dr. Fiona, please.
I'm sorry, I didn't get the first part of the question. If you could ask it again.
Sure. The first part is talking about the plan of action for next year regarding the COVID-19 pandemic in Africa.
Okay, thank you very much for that question. Just to say from the outset that the COVID-19 pandemic is still very much ongoing, and we are encouraging that countries maintain the vigilance in ensuring that the necessary measures are maintained. We have seen overall over the past few months a decline in the incidence of new cases of COVID on the continent, and that's encouraging, but this is being interpreted on the backdrop of reduced testing that is witnessed in most of the countries. We are looking at the future as well. In many countries, we are seeing the planning going on towards integration or transition of most of the key interventions for control of COVID into the broader health systems, into the surveillance systems or vaccination programs. So we are also trying to provide that guidance to the countries as to how these interventions could be transitioned, but maintaining the focus to ensure that should there be COVID-19 cases out there, that the system is still there to be able to do the surveillance as well as to do the testing, and that the necessary measures in terms of controlling spread are still known on the front lines, and that these are followed. So overall, decreasing incidence observed. We are seeing the lowest number of cases now, new cases, compared to when we started with the pandemic, but important that countries maintain the vigilance, surveillance, testing, and case management remain key, and encouraging that the countries, as they do the transition, bear these processes in mind to ensure that the minimum interventions are maintained.
Thank you, Dr. Fiona. We have another question for you, this time on Ebola vaccine. When are the Ebola vaccines expected in Uganda, and do they still make sense since contacts cases have reduced? Dr. Fiona, please.
Yes, as Dr. Karamaji mentioned earlier, we are encouraged with the progress in the response to the Ebola outbreak in Uganda. Due to the immense effort of the government of Uganda with the support from partners, we are witnessing a slowing down of transmission. Over the past 2 weeks, only one case has been reported. However, in spite of this progress, we are not yet out of the woods. The outbreak is dynamic, and we do not know how it will evolve. It is still too early to say that. And we need to be ready to adapt to the evolving situation. Vaccines are part of a comprehensive package of interventions to control the Ebola outbreaks. They help to get the control much quicker. We, as you all know, do not have a Sudan virus vaccine available, but this outbreak has allowed for the
We are sorry
in getting vaccines.
Dr. Fiona seems to have some connection issues. While she's sorting out the network issues, we are going to move straight away to Dr. Humphrey. Oh, Dr. Fiona, you can go ahead, please.
Apologies, I got disconnected. I hope that the first part was heard. I was saying that the outbreak has allowed us to advance on the vaccine front with significant progress over the past 2 months. Manufacturers are working hard to on the pre-filling of and packaging of vaccine vials. The packaging has taken a bit longer than we envisaged, but according to the feedback we have from the manufacturers, we expect to have the vaccines in the country soon. These vaccine trials the vaccine trial will target close contacts of confirmed cases based on a standard protocol. And we need to have adequate numbers of contacts to get the necessary information. So a decision will be made once the vaccines arrive in the context of the evolution of the outbreak as to how we will implement the trial. But in the meantime, we commend the government and Makerere University that is leading in the trial in getting the necessary preparations on board. The protocol has been approved by the local authorities. We have 200 field team members that have been trained. The ultra cold chain equipment is in place and the personal protective gear is in place. So everything is ready to receive the vaccines and to kickstart once the vaccine arrives. Thank you.
Thank you, Dr. Fiona Braka, for that information. We move right away to Dr. Humphrey. We have a question from Kelly Kulinan from Health Policy Watch. Is it possible to estimate what percentage of maternal deaths are linked to unsafe abortion? Dr. Humphrey and Dr. Serge can complement. Dr. Humphrey.
Thanks a lot and for that question from Health Policy Watch. At present, I think the straight answer is no. There are different policies in different countries around safe abortion, and the pattern will differ really on a country by country basis. Even within a country, it will differ quite a lot in different regions. So I think it's best to have that question explored at each country at the level of the country, as opposed to a regional kind of response. I think what we do know is that the major cause of maternal deaths at present is bleeding, particularly during the labor. And I think that is, if it's due to unsafe abortion or it's due to lack of appropriate care and so on, I think it's important that we unpackage what is driving that major cause in the different countries and address it. Thank you.
Thank you, Dr. Humphrey. Still on primary healthcare, Dr. Humphrey, can you tell us how can WHO really support primary healthcare in sub-Saharan Africa?
Yes, we have, as WHO, we have placed the attainment of a primary healthcare approach as really central towards moving towards the SDG goals or the specific health goals in each country. And this has many different interpretations depending on the country. But what we want to see at the end of the day is that every person in the countries of the region have access to the essential services that they need for their health and well-being without the risk of financial catastrophe. I think that is the aim, and different countries are taking different paths. It needs a lot more investment. I think that is a given. When we look at the levels of investments that are being made in our countries and compare with other countries which have achieved PHC, we see that the investment levels are really low, and we need to improve on those. But also it needs a lot of governance reforms, thinking differently about how we provide services, taking advantage of new innovations, telemedicine, and all these different ways that we can get services out to the people, the services that they need. So really, each country, again, we need to be thinking within each country, what would work best? What mix of actions do we need to prioritize that stage of attaining the PHC approach in our respective countries? Thank you.
Thank you, Dr. Karamaji. Dr. Sofa, do you want to comment on this? Maybe in the line of telling us how primary healthcare can best be improved. Dr. Sofa?
So, I mean, just to kind of, so that I don't repeat what Humphrey has said, really, I think PHC is really central in the attainment of UHC, and largely because in all the, and this is also speaks to the report, quite a number of the challenges, the challenges that are lagging behind, which are kind of direct healthcare or health services responsibility, are issues that we actually have solutions, technical solutions for. And the biggest challenge has been access. And PHC is very, very central in ensuring access to, literally equitable access to, including the most difficult people to reach. So, I mean, certainly, yes, there is need to, and certainly for the region in our quest towards driving the region towards improvement in the UHC performance index and ensuring equitable access to services, PHC needs to be repositioned centrally. This will require a bit of remodeling, including rethinking about how systems are organized, how systems are financed, and how services are delivered across systems, which require a bit of structural and governance system strengthening approaches within countries. But yes, I completely concur with Humphrey that PHC is probably one of the low-hanging fruits to assist and facilitate countries towards the attainment of UHC in the region. Thanks.
Thank you very much, Dr. Sofa. We have a question for Dr. Fiona Braka from Nigerian TV. What are the measures put in place to completely eradicate diseases such as Ebola virus and the likes? Dr. Fiona, over to you, please.
Thank you for the question. It's important to understand the causes, the root causes of these outbreaks. Ebola is one of those diseases that has been with us mostly in DRC, but you also recall the large outbreaks we had in Western Africa. And we have also seen outbreaks in Eastern Africa, Uganda and Sudan in the past. Most of these diseases are hosted in animals, and it has a lot to do with the reservoir where these animals are. It has also a lot to do with the behaviors, how humans interact with the animals. A lot of the time, people culturally go hunting, and when they are in touch with the reservoirs, they then get exposed to the virus. We've seen this for a lot of the viral hemorrhagic fevers, but there are other zoonotic diseases that we are seeing on the increase because of that animal to human interaction. So as long as we have these reservoirs in our territory or on the continent, as long as we have the behaviors that allow for interaction between man and the reservoirs, then it is a challenge, and a lot of it will then go to how we educate or sensitize communities on how they can protect themselves. Of course, once it is spread to man, then there's the human-to-human interaction that comes into play. We also need to sensitize those that are infected on how they can prevent spread of disease. And we have other tools that have also come into play, the vaccines, which have evolved over the years and are allowing us to contain outbreaks much faster. So it requires a combination of interventions to control these outbreaks. Of course, with the urbanization and movement of people, the deforestation that is going on, climate change that is going on. These are all contributing factors that will predispose us to outbreaks. And we have done an analysis from a regional perspective, and we are seeing the impact of all these contributing factors that are facilitating increase in the number of outbreaks that are related to animals, spread from animals, or due to climate change. So it's going to require a lot of joint effort really to address the reservoirs, but also the behaviors of people, as we also advance the science in getting more vaccines out there to protect people from these diseases or to control the outbreaks quickly. Thank you.
Thank you, Dr. Fiona Bracker. It is my understanding that Janice from Bloomberg has her hand raised. Janice, you want to go live with your question? Please go ahead.
Can you hear me?
Yes, please, Janice, go ahead. Janice? Well, while waiting on Janice to sort her issues, we will go from a question from Nigeria, this time to Dr. Humphrey Karamaji on maternal health. The question is, what is the hope of maternal child health for Nigerian space, especially along the urban-rural continuum, and how can we make the positive change that is needed in that regard? Dr. Humphrey Karamaji.
Thanks a lot. And yes, I think Nigeria represents a country with which has quite a high number of maternal deaths within the region. But I think this the best response, I think, to this relates to the question that we had just responded around the PHC approach. I think if we're able to really make sure that the primary healthcare approach is being well implemented in Nigeria, we do believe that that would significantly reduce the maternal deaths that are happening in the country. The main advantage that we have with the primary healthcare approach is that it does not respect urban-rural divides and so on. The focus that we are placing is on the mother, irrespective of where she is. So is she able to get the services that she needs, whether she's in an urban place or a rural place? How does the sector organize itself so that she's able to get the services that will help her to avoid the maternal mortality? So really, we would encourage that we look at how to really deepen the revitalized PHC approach within Nigeria. That, in our view, would offer the best possible approach to really reducing the maternal deaths that the country is facing. Thank you.
Thank you, Dr. Karamaji. Janice, are you ready with your question right now? You are unmuted. You can go ahead with your questions, Janice. Okay, Janice seems to be unavailable while at it. Dr. Fiona, do we expect like a rise in COVID-19 cases with the holiday season coming in? Dr. Fiona, please.
Yes, thank you for that question. As we move towards the holiday season, we have always reminded over the past 2 years about the risks associated with increased interaction of people, movement of people, We are also doing this reminder in the context of Ebola in Uganda, because you will have lots of mobility, and you will have people interacting as part of our social being. It's important to remember that how these viruses are spread, and to take the necessary precautions. Typically, we have seen those waves happening towards the end of the year, again associated with these increased mobilities and interactions. We do hope that people are well sensitized on how to manage this. We also know towards the end of the year, it's the winter season in some places. So again, predisposing to some of these viral infections. So our appeal is just to encourage that we maintain the necessary public health and social measures, wear a mask, avoid close contact, keep the minimum distance, ensure you wash your hands and sanitize as much as possible. If you are responsible to assess your level of risk around you, if you're in a crowded place, please take the necessary caution. And also we're encouraging that those that have not received their vaccination against COVID to please ensure that you're vaccinated with the 2 doses and the booster for especially the high-risk groups. Thank you.
Thank you very much, Dr. Fiona. Janice, if you are ready to come online, but if not, I will take your questions which is directed to Dr. Lule about the CAP-LA. Is WHO and its partners in talks on how to set the price for this that African countries can afford, a price that African countries can afford? And how quickly can we give this to pregnant women? Dr. Lule.
I'll start with a second. I don't think I have an answer as to how soon we shall get this game-changing medicine to pregnant women. CAP-LA, for all colleagues, stands for cabotegravir, long-acting cabotegravir, which is a wonderful game changer and one of the tools now we have for HIV prevention, where you give an injection to someone, especially at high risk of acquiring HIV, and it has been found to be very effective. Now, on the actual question as how is WHO making this intervention available, as you know, at the International AIDS Conference in July, this is when the guidelines for WHO were launched. And since then, there is a coalition that has been put together, and it's convened by WHO and other partners, for example, UNITAID, the Global Fund, and other partners, including communities, for example, the International Council of Women. And the whole point is really to identify ways on how we can speed up access of CAP-LA to countries, also find ways on how this medicine can be procured and made available, and also for countries to be able to take this through their regulatory agencies as quickly as possible to make it available for procurement. As we speak now, the medicine is going through the regulatory processes, and I must say it's not fully available for countries to take on. And I think Zimbabwe became the first country to get this medicine registered, and we are working with others to get it registered. But as to how soon it is going to happen, I really do not have a concrete answer, but let's hope within the coming year, this will be available for as a tool within our HIV prevention kit. Thank you.
Thank you, Dr. Lule. Thank you for that information. We are coming to an end to this virtual press conference. I will now turn to our two panelists for any final messages, starting with you, Dr. Benjamin Sofa.
Thank you, moderator. Really, I mean, from my end, really first to thank my colleagues from the regional office in WHO Afro for inviting me and honoring me this opportunity to actually be part of this launch of this Atlas for Health in Africa. I think, as I said in my opening remarks, this report is an important advocacy, but also accountability tool, because it enables us at this point in time as stakeholders in health across different countries to take stock of where we have been, but also think about how to re-strategize to meet the unmet targets as we work towards the end date of the SDG targets. So many congratulations to all those who are involved in putting up this report, and thank you for honoring me being part of this this launch today. Thank you, and over back to you, moderator.
Thank you, Dr. Benjamin Sofa. Now on to you, Dr. Humphrey Karamaji, for your final word, please.
Okay, thanks a lot, Tabi. I think we would want, on behalf of the Assistant Regional Director, to thank the journalists and everybody who has been here. The questions have been quite interesting. Please, we can continue the discussion even after the press conference. If there are other issues which you need clarification on, or which you find would be interesting to explore further, we are available and would really encourage that you do get in touch with us and have that discussion. I think from what we've seen on this World AIDS Day, we see also what's happening in Uganda with the Ebola. We see what's happening in COVID. I think the general outlook looks positive. I think we are moving in a good direction as a region. There are a lot of challenges, but we feel that there are enough levers that we have a hold of at present to help us to move forward. So as we move forward, I think the report that we've launched today gives you a very good picture of what is going on, what levers we have that we can hold on to, the progress which we are making in HIV, in COVID, in the Ebola outbreak, I think are all really positive things. So let's work together and make sure that we are able to move in a positive way for the health of the people in our region. Thank you for taking the time off to join us, and we really look forward to moving forward. Thank you.
Thank you very much, Dr. Humphrey Karamaji. Thank you to all our panelists and experts for the information shared. Thank you to everyone who participated. See you at the next press conference.